It's Dr. Ann Zink. Today's December 4th and providing a brief update with where we're at with COVID. So, unfortunately, today we do have a total of 744 new cases. And unfortunately, we do have 12 additional deaths. So, to each one of their friends and family and all of their loved ones, we're thinking about you. In looking at our deaths, we do have a series of recent cases, as well as we have some cases that came to us previously by the death certificate review process. So we have three recent cases, a woman from Anchorage in her 90s, a woman from Kodiak in her 80s, as well as a woman from Kenai in her 80s. And then we have nine cases that came from the death certificate review process, including people from their 60s to 90s in the areas of Anchorage, Wasilla, Utqiagvik, Cordova, Kenai, and Wasilla. So thinking about each of them at this time. I wanted to provide a brief update with where we're at. If we're looking at our graphs in our slides, we continue to see an increase across the state. We've had some very high days here the last couple of days in the 700s. On this graph, you can see the report date and you can see the onset date. It's important to look at both. The onset date is the onset of symptoms or the test, whichever was earliest. And that gives us a good sense of where the trend overall is going. So if there's a backlog in data, the onset date is really helpful versus the report date is the date that it was reported to us. I would caution people that the onset date is always going to look in that most recent 7 to 10 days to be artificially low because those are tests that are still currently running. So you always want to ignore the most recent about week of the onset date, but you can overall look at the trend on the onset date, and that gives you a better sense of where things are moving across the state. The other thing I wanted to emphasize was our percent positivity. It continues to still be higher than that 5% we'd like to see, but we've really had a huge jump in our airport percent positivity. So that now is above 5% from the airport. So there's a lot of people on the plane flying recently who have tested positive. So again, the more that you can get tested prior to flying, again, 1 to 3 days prior to flying is ideal, so that you don't accidentally fly on that plane and expose other people during your transit through the airport or on the plane during that time. Right now about 1 in 20 passengers on the plane is positive with COVID. If those people were all tested in the airport, which the majority of Alaskans get tested at the airport and not before. Our overall percent positivity has come down a bit. So we're hovering just above that 6% range, still remain the second most tested state in the country with over 1 million tests performed. There have been some challenges to turnaround times, which continue to work through. Again, if it's been more than 3 to 5 days, please call your testing center to see where it's at and check your spam box. A lot of it gets sent to the spam box. Want to make sure you see it there. The big thing that we've been working on all this week, there's been tremendous movement on this, is our vaccine development and preparedness. While we don't have vaccine now, we are going to have very limited vaccine availability very soon in the state of Alaska. We actually have to submit our plan today on exactly where we want boxes sent. There have been a couple really big developments in the state here recently, including the fact that we will get our month's allocation up front, given our rural geographic nature, to help us then redistribute it more quickly. And I think that's really going to help overcome some of our major geographic limitations in the state. And I'm very grateful for the federal partnership to being able to have that option. I think that's going to be a game changer in the state. So we'll be getting Pfizer vaccine initially. The EUA is still in the process. We got to make sure that that is completed first. The ACIP, a major group that does recommendations, met and voted on Tuesday, and then our state allocation met yesterday and had 100% confirmation of where they saw the tiers within first group, or the first 1A group. So really looking at those frontline healthcare workers who are directly exposed, as well as long-term care residents and staff are all going to be part of that phase 1A and other kind of high-risk groups along that. So we'll provide more information, but we continue to have our echoes. I think of how we're doing vaccine allocation like this nesting doll. So the national ACIP recommendations are kind of like these big recommendations, and that has to do with what's logistically possible, where the science is driven to really show who would benefit the most from these vaccines, as well as really how to make it as equitable and save as many lives as possible. So for example, our long-term care residents, we do know are at really high risk for death if they do get COVID. And so we really want to make sure we protect them. It also helps to free up additional resources, things like testing, so that we can reallocate those if we can protect those individuals as quickly as possible. So we're trying to maneuver our resources as efficiently as possible for the welfare of Alaskans. But with inside of these nesting dolls, there's all sorts of different layers. So then the state has an allocation committee, and then communities and hospitals are being asked to figure out how they're going to allocate within those guidance. And then all the way down to you as the individual Alaskan making a choice about getting a vaccine. These vaccines that are coming out, there's 2 of them right now that are in the review process, their final review process, and they look highly efficacious, meaning they look like they do a fantastic job at preventing severe illness. They also look like they do a good job at preventing all illness from COVID, but not quite as good as the severe illness component. What we don't know is if you could still transmit COVID-19 if you got the vaccine. So we're still learning a lot about that, and that's still to be determined, but it's great to see the severe illness be protected from it. I would also say that a vaccine is only as effective as how many people are willing to get it. And so we want to make sure that you as Alaskans have the information you need to make the decision to get a COVID-19 vaccine when it's your turn to get it. So tune into any of our echoes, check out our website, ask your healthcare provider. We're doing a lot of outreach there. We want to make sure that you have the information to make the decision because it's only as effective as how many people are willing to get it and are able to be protected. I will just note that it was not tested in children or pregnant women. And so those will be much lower down because we need to see those tests done first. And we really are going to only be recommending it to those who the data and science supports that it's protective for them and it's been studied. So the shipping with vaccines is quite challenging, particularly in the winter with an ultra cold storage. And so there's a lot of work happening along those fronts right now. And we're working through the details of that. But our goal is to have it as accessible as possible. But again, it's going to be limited allocation at first, and then that will hopefully broaden up quite quickly, particularly as hopefully we get more vaccines on trial. Another big change that happened this week is the CDC changed their quarantine guidance. So the incubation period, the time it takes from exposure to the time that you could potentially develop COVID-19 still remains 14 days. That didn't change. And so if you had a close contact exposure, you still really need to watch yourself for the full 14 days. But we see that most people get symptoms earlier than 14 days, somewhere between days 5 and 10, and that you test positive sometimes before you develop symptoms. And because of that data, they have now changed the quarantine that you need to quarantine for 10 days instead of 14 days, but still watch your symptoms for the full 14. And if you can get a test, that can shorten the quarantine period all the way down to 7 days. This is a big change. This will miss a few people on that kind of tail end, but will catch the majority of people. And so some communities are still sticking with the 14 days, and there's no harm in that. But we also know that 14 days is a really long time. And so we want to make sure that you have the science and data that's out there on the quarantine period. And so we are working at changing all of our guidance to really reflect this 10 days for quarantine, but that can be shortened to 7 days with a negative test for COVID-19. It's going to take us a couple weeks to get all of our contact tracers educated and all of our testing guidance changed. So appreciate your patience as we're working through that process, but want to make sure you have it as quickly as possible. And here's the data behind it. So you can see the number of people who were quarantined with and without symptoms, and you can see the length of time, and it really diminishes in that day 10 to 14. So while it's not a zero, it goes down significantly, and it's based on this data that the CDC made their most recent recommendations and why we're adopting them. It's important to remember that if you're having any symptoms, the more data I look at, the more it's so clear that the moment you have symptoms, you need to isolate yourself from others and get tested. We see on average people wait 3 days to get tested. If they could get tested on day 1, that would have a big impact on the transmissibility and how much virus we have spreading. Because if you get tested right away and you isolate right away and you let your contacts know right away, it makes a really, really big difference. So please, 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 even just one symptom, isolate and get tested right at the very beginning. I know it's hard and it's frustrating, and some people have had to do this multiple times, but it really makes a big difference in decreasing the transmission so that we can keep schools open and we can keep businesses moving forward and we can keep the hospitals from being overwhelmed. So if you're having any symptoms, get tested early and isolate. I also just want to emphasize that with COVID-19, you can become what's called a happy hypoxic. You can feel okay with just mild symptoms, but your oxygen level can drop quite low. And so we have been encouraging people who have COVID-19 who are at home to consider getting a pulse ox, a little device that checks your oxygen level at home. And if that drops anywhere below 90% consistently, then you really need to go into the emergency department or to a clinic to be seen. It's good to check it a few times a day. You can buy these at the store. Our public health nurses are distributing them. Many hospitals are distributing them via the emergency department. but we really want to make sure that you've got the information to make sure that you're doing okay at home. It's impressive how well some people can feel with their oxygen being low, and that low oxygen can hurt their brain, their kidneys, and other organs. There's been a bunch of recent studies out on masks. And so, again, masks work. They're not perfect, but they are a strong tool at mitigating disease. And so, there was another recent study that used a bunch of mannequins from Mayo that really emphasized that 6 foot distance and masks. So, again, our highest risk activities are those times when we're indoors and we're not masked and we're not distanced. But we have so much COVID spreading right now that we need to really do all that we can to mask, distance, as well as do everything we can, either outdoors or with highly ventilated spaces to minimize your exposure and risk. It's a sneaky disease. I keep getting stories from people across the state who say, I took all these precautions, but I got my car fixed. I did this, I did that. And that was the place, even with a mask, that they could potentially get infected, particularly if they're in an indoor space for an extended period of time and not maintaining those 6 feet distances. So I just really want to emphasize, the fate of this virus and the fate of our state is not determined for us. We get to determine what this looks like. We write the stories, and we can see the finish line at the end with this vaccine. I'm incredibly hopeful this week with treatment options on the line and incredibly efficacious vaccine. I think the accomplishments of what's happening with science right now is kind of like putting a man on the moon. It's remarkable to watch the science come together, and I am so excited to have vaccine soon here in the state to be able to move to a different place where we can put this in our rear view mirror and lessons learned. So I would just really emphasize the more that we work together right now by keeping your distance, wearing a mask, washing your hands, increasing your indoor ventilation, keeping those circles small, will really determine our stories and what the stories look like for our future and how well we're able to take care and protect each other as communities. And so thank you for all that you're doing and helping us figure out how this story ends because the end is in sight. So with that, take care, be well, stay connected, and just know that what you do really does matter. Thank you.